Hello, welcome to Wild Child Wellness, where we discuss natural remedies for common childhood symptoms and when to seek medical attention. I'm Julie DeVono, and I have 30 years experience as a pediatric nurse, as well as homeopathy and medicinal herbalism. So I'd just like to say I pull from more than one toolbox. And the purpose of these videos is to provide some information on different natural remedies that you might have available to you as a parent if you wanted to try something before having to seek medical attention. These videos are for informational purposes only and not a substitute for medical advice from a trusted medical provider. So the topic of today's video is swimmer's ear. We often equate swimmer's ear with being just a summertime thing, but it doesn't have to be, especially nowadays as people go on vacation, or a lot of children, even in the middle of winter, might take swimming lessons. And, and also when you get children at a certain age, it doesn't matter what time of year it is. If, they're taking a bath and they have gotten to the point where they can put their head underwater, they like to do that, and they like to do it a lot. So, it could be the middle of winter and you're dealing with a swimmer's ear because your child just likes to stick their head underwater a lot, or maybe they just started taking swimming lessons. Now, swimmer's ear is a type of ear infection, and we often just differentiate it from a traditional ear infection. The medical term for swimmer's ear is otitis, which means inflammation of the ear, externa, which means it's external, as opposed to when we think of a traditional regular ear infection, that's referred to as otitis media, and that means the inflammation in the ear is behind the eardrum. So the cause of that is different, and the treatment is also different. So today we're just going to talk about the external ear infection that's known as swimmer's ear. And both types of ear infections are actually what we call secondary ear infections. And a secondary infection, like a sinus infection, some bronchitis, some skin infections, and swimmer's ear, that's when the infection follows another problem. So you may have a cold or allergies, and then after a week of runny nose and congestion, you get fever and ear pain or sinus pain or chest pain and a cough. That's because you started with a certain part of your body being compromised, like in swimmer's ear, it's where water gets into the ear canal. And if you don't get it out soon enough, then it triggers an infection. An inner ear infection, kind of same thing, except it starts with a cold or allergies. So you have runny nose from a cold or allergies, and you get congested, and the fluid backs up the eustachian tube, which is a tube that connects the back of your nose to behind your eardrum. And then if you're congested, that tube can swell shut, and now that fluid's trapped behind the ear. So you may have cold or allergy symptoms for a week or two, and then you develop fever and ear pain. That's a secondary infection, and that's usually an ear infection. You can get it with like sinus infections, or the same thing. You get, fluid trapped in the sinuses, and it festers. And, I use the analogy a lot. It's like having a flooded basement. So if a certain part of your body that, has, when you're healthy, there's a normal amount of moisture, a normal amount of airflow, but then due to increased fluid drainage, like a runny nose or congestion, fluid gets trapped somewhere it shouldn't. So like it gets trapped behind the eardrum and it shouldn't, and then it festers and builds more bacteria and fungus, and then that develops into an infection. Now with swimmer's ear, it's exactly the same thing that's happening. The water has gotten too deep into the ear canal, and now it's like a flooded cave system or a flooded basement. So an area that's supposed to be pretty clean and dry, now it's wet and it's got fluid in there, and you've got this warm, dark, moist environment, and that triggers the normal skin flora, which is the bacteria and fungus that grows on the skin normally, to overgrow. Kind of like after a couple of days of rain and then a lot of sun, your garden, your vegetable garden just grows like crazy. Same kind of thing. You get this water from your child putting their head underwater. They submerge their head underwater. The water gets really deep, deep, deep into the ear canal. It can't dry out well enough, so it starts to breed more bacteria and fungus and cause, really, it's in a way, it's like a skin infection of the ear canal, in front of the eardrum. So that's why you'll hear some people say using things like a hair dryer will help relieve the discomfort and help treat it, or using a hair dryer after swimming. What they're really just doing is preventing that festering by drying out the area so it doesn't become this long-term warm, dark, moist environment that lasts for long enough to have that bacteria grow. So now I've had some people ask, well, what about my kid taking a shower, or what if they just get their hair wet, or even if they get their head wet? For a swimmer's ear to occur, it's not just a little splash. Just splashing water on your head isn't going to do it like a shower. You've got to submerge your head underwater, because when you submerge your head underwater, that's what allows that water to flow in and get really, really deep in the ear canal, kind of towards the end of a long, dark tunnel, if you think about it. And so, the normal pattern that I see is the child has been taking swimming lessons, or they just discovered how to put their head under the water. And after doing that, maybe 3 to 5 days later, they start complaining of extreme ear pain. Swimmer's ear can actually be more painful than a regular ear infection. And in fact, I would say most of the time, swimmer's ear is extraordinarily painful and more painful than a regular ear infection. And that's one of the ways that we triage it. One of the ways we can discern that is if a child comes in and they are just in extreme ear pain, I'm more likely to suspect swimmer's ear than a regular ear infection. And one of the ways that you can also tease it out is with swimmer's ear, if you move the top of the ear up and down and around like this, or this little bump that's in the front, that's called the tragus. If you wiggle the tragus and it's a swimmer's ear, you're actually moving the ear canal, and they will just react like you're stabbing them in the head. They're going to be like, whoa, this is really, really painful. So that's when you can kind of know, okay, this is probably more of a swimmer's ear than an inner ear infection. Now, with an inner ear infection, they may be in pain and they may come in saying, oh, my ear really hurts. But when you do those manipulations, when you move those parts of the ear around, it doesn't necessarily feel better, but it doesn't feel worse. It's just the same level of pain. So now if you have that extreme pain with movement of the parts of the ear, and there's no fever, no runny nose, no congestion, no history of cold symptoms or allergy symptoms, then if the information isn't volunteered, oh, well, we just got back from going to Florida and the hotel had a swimming pool and my kid was swimming a lot. Or, oh, my kid just started taking swimming lessons a couple of weeks ago. They've been going 2 or 3 times a week and they're putting their head underwater. If you don't get that information voluntarily told to you, you could just ask, and that's what I would do. I would say, hey, by the way, has your 3-year-old or your 5-year-old, have they just discovered how to put their head underwater? And have they been doing that a lot? And often the answer is, yeah, hey, they have. And, so that's part of trying to figure out what's going on. So now you're pretty sure you're dealing with a swimmer's ear. So how do you treat it? Well, like it comes up in almost every video. It's probably my favorite go-to product, but you get your colloidal silver drops. Colloidal silver is a really powerful natural antibacterial element or bacteriostatic element, meaning it kills bacteria or stops bacteria, suppresses bacteria. And it's what was used prior to the advent of modern antibiotics on the battlefield with wounds, or typical everyday medical care if somebody gets a cut, or if they have other issues going on where they need, if they have some other bacterial infection going on. The old-time physicians actually used what they called sovereign silver, but silver has always been appreciated for its antibacterial properties. So when you buy the colloidal silver, it's just a clear liquid, usually like a distilled water with very, very tiny particles of the silver dispersed in the fluid. So, you have your swimmer's ear, you grab your colloidal silver, you're going to have your child lay down with the ear that's bothering them up, and you put enough drops of the colloidal silver in their ear canal to fill the ear canal. It's normally about, depending on the size of the child, somewhere between 4 to 6 drops. but there really isn't an exact number. What you really just want to do is just keep putting drops in until you see that the ear canal is full. And then you can even put a little cotton ball in there to try to keep it in place. But that colloidal silver is going to work on killing that bacteria, which is what is causing the pain and the infection. Now, the biggest thing too is, it's really hard when your child's in that kind of pain, and you want to try to be patient with the process because it's going to take a couple days to treat. So I would also recommend maybe some belladonna for pain, or arnica. The arnica in this situation would probably be a better choice. Belladonna I really use more for just fever. The arnica is really good for pain. So you can get arnica pills from a natural remedy store and use that as almost like a homeopathic or natural Tylenol or ibuprofen. And if you don't have that, give them Tylenol or ibuprofen. Give them whatever you need to help relieve that pain, because it is very painful. And it's very hard to have the patience to wait for the colloidal silver to treat the infection if you're uncomfortable. So, that's... Now, a lot of times if a child gets swimmer's ear, it may be a sign that they're prone to it, either because of their behavior. Maybe they continue putting their head underwater, or they're swimming a lot. So parents will ask about, well, how can I actually prevent swimmer's ear from occurring? And there are some things you can do for that. And, one of those things is just getting vinegar, because I've talked about in other videos, vinegar is really good at suppressing bacteria growth as well as fungal growth. And sometimes with swimmer's ear, you can have a mix of bacteria and fungus. So that's where the vinegar is really helpful, because it suppresses both of those things by creating an acidic environment. Acid kills bacteria and kills fungus. So if you have a child that's taking swimming lessons, or it's the middle of the summer and you just know that they're going to be like a fish swimming every day in the pool and they're going to put their head underwater, you don't have to do it immediately, like as soon as they get out of the pool. But every night at bedtime, before they go to bed, put some vinegar drops in their ears, and it'll help prevent, it'll create that acidic environment, which will help prevent that infection from occurring, from that bacteria and fungus to grow to a level where it's going to cause that infection. And, sometimes people just get in the habit of doing that anytime their kid's swimming, and that's fine. It's, short of smelling like a salad, it's not going to harm them. You don't need to use the expensive apple cider vinegar, although you can if you have it. It's expensive, and just good old-fashioned distilled clear white vinegar will work just as well, because it's really more about just the acidic nature of that product that you're using to treat and prevent the problem. So now with swimmer's ear, like I had alluded to earlier, you usually don't have fever. You usually don't have cold symptoms. You've been, putting your head underwater, and now you have pain. If you've been using the vinegar drops and they still manage to get a swimmer's ear infection, and then you've been using your colloidal silver drops for a couple of days and it's not getting better, that's when you would want to seek some medical advice. Now, I do want to touch on a certain treatment that's very often used, and you can even try using it at home, and that's called an ear wick. Now, an ear wick is something that you would have supplied in a medical office. If you would go to a regular pediatrician's office or urgent care, they'll often have ear wicks to treat swimmer's ear. And you can buy them on Amazon as well if you want to keep them in your home. They're not like a prescription device. All it really is, and it's kind of funny to think of it this way, but an ear wick is just a very, very teeny, teeny, tiny tampon. So, it's like, I guess, tampons for fairies or elves. I don't know, but that's all it is. So it's this teeny, tiny little stick of cotton that when you get it wet, it expands. But that's perfect for treating swimmer's ear, because what you would do is you would very gently insert the ear wick into the ear canal. You don't want to insert it too far. You don't want to lose sight of it. You want to be able to pull it out. But, you start with inserting the ear wick into the ear dry, and then you start dripping your drops of colloidal silver onto the ear wick, and it will get wet. And when it gets wet, it'll expand, and that will hold it in place. But what's brilliant about the ear wick, and why it works so well and works much faster than just doing the drops, 3 or 4 times a day. Like if you get a prescription for swimmer's ear drops, they're antibiotic drops, and you usually have to put the drops in 4 times a day. Well, the problem with kids is, you put the drops in, an hour later, they're not in there anymore. They've either dried out. So that's why you have to do it so frequently. What's great about the ear wick is it stays wet for a while and it holds itself in place. So the reason why often the swimmer's ear will be treated faster and it'll resolve faster is because you're constantly holding your antibacterial agent, whether it's colloidal silver or drop or prescription drops. It's holding that bacteriostatic agent against the skin for a longer period of time. Because if you're treating a skin infection, the longer that antibacterial or bacteriostatic agent, whether it's a prescription or colloidal silver, the longer it's in contact with the infected area of the skin, the better it's going to treat it. And that's all you're really doing in this situation. So either having them at home to use with the colloidal silver, it's a great option to have. And then when the earwick dries, when all of the fluid is used up and it just dries out, it'll shrink again, and then it'll either fall out, or you could just take some tweezers and gently pull them out. Sometimes you can even just pull it out with your fingers, but that's how that works. So if I put an earwick into a child to treat a swimmer's ear, I'll tell them, don't pull it out, leave it be, let it just do its job. It will fall out on its own eventually, and that way you're not. And, when you have a little kid that you're trying to hold them down to put eardrops in 4 times a day, I mean, parents, we have better things to do. It is not fun. So, if you do have to go to urgent care or to your doctor's office for swimmer's ear for treatment, you can request an ear wick, and it'll make your job a lot easier, and it'll also treat the problem a lot faster. And if you want to try to treat it before it gets to that point, your child's got some mild discomfort and it's a swimmer's ear, you can even use the ear wick with the colloidal silver on your own, and you might not even need to go to the doctor's office. So that's always a good thing. So I hope you found all of this information helpful. And if you want to reach out, there's many different ways to either check out some of my other videos that are on YouTube or Patreon. I also post reminders on my Facebook page as well as other information. You can also follow me on Instagram or even Twitter, X, I call it Twix. But and then there's also good old-fashioned email. I still have one of those, and you can check my email. Or, I'll check my email. You can send me an email. And if you have any questions or any ideas from other topics that you specifically want covered, or if you want to set up a consult. And in fact, I still even have a telephone. I have a cell phone and I use it. So you can reach out to me by phone, texting, or calling. And, and hopefully that'll cover everything. So anyway, I hope you found this video helpful, and I hope everybody stays healthy. It's a beautiful day out there, no matter what kind of day it is. So get out and enjoy it. I'm going to do the same. So be well.